Good morning. I am Criselyn Gasagas, and today we are going to discuss about the symptoms and condition, also the diagnosis and treatment in the cardiovascular system. So first we have bruit. Bruit is an abnormal sound heard in auscultation. What is auscultation? Auscultation is a method used to listen to the sounds of the body during a physical examination by using a stethoscope. So, a bruit is a noisy blowing sound found within a vascular structure like an artery due to turbulence of blood flow. This occurs because this artery could be narrow or there could be a partial obstruction like through a fatty plaque. So, in abdominal assessment, you will be listening at various parts of the abdomen like the femoral, iliac, and renal. You will also be listening for a bruit at the carotid arteries when doing a neck assessment. So, remember that if a bruit is present at the carotid artery, it could indicate a warning sign of stroke. So as a becoming nurse in the future, in examining our patient's body, we must very mindful and observing to every sounds our patient's body produces. Next is cardiac tamponade. It is a pathologic accumulation of fluids in the pericardial sac. It may result from pericarditis or injury to the heart or great vessels. Cardiac tamponade is a pressure which obstructs blood flow of the heart. It is a pressure in the heart that occurs when blood or extra fluid builds up in the space between the heart muscle and outer covering sac or the pericardium of the heart. As a result, the heart muscles unable to pump normally. In this condition, blood or fluids collect in the sac surrounding the heart. This prevents the heart ventricles from expanding fully. The excess pressure from the fluid prevents the heart from working properly, and as a result, the body does not get enough blood. Cardiac tamponade can occur due to heart surgery, heart attack, wounds to the heart, and heart failure. Next is ectopic beat. Ectopic beat is a heartbeat that originates from some part of the heart other than the SA node. An ectopic heartbeat happens when your heart beats too soon. It can feel like your heart skipped a beat or it is racing. These heartbeat irregularities can be scary but aren't usually harmful. They often result from stress and too much intake of caffeine, alcohol, or certain cold medication. So, next is extrasystole. Extrasystole is a premature heart contraction that occurs separately from the normal beat and originates from a part of the heart other than the SA node. So, extrasystole is a premature ventricular contraction and a type of cardiac arrhythmia. Arrhythmia is an abnormality in the rate of rhythm or rhythm of the heartbeat. So, extrasystole occur whenever a contraction stimulus is sent ahead of time from the sinoatrial node in the heart, giving a rather unpleasant sensation of a skipped heartbeat. So, extrasystole can be triggers due to anxiety, prolonged stress, fatigue, or generally feeling unwell. So, in order to prevent extrasystoles and also ectopic beat, we must change every lifestyle that triggers them, like smoking, drinking alcohol, and try also to sleep on time at night. So last is flutter. It is a very rapid 200 to 300 BPM but regular contraction as in the atria or node ventricles. So flutter is a type of supraventricular arrhythmia. This means it is an abnormal heart rhythm that starts in the upper chambers of the heart, which the heart beats in a fast but in a consistent pattern. Our normal beats is 60 to 100 beats per minute, and imagine having the 200 to 300 BPM that could form a blood clot, which could cause a stroke or heart attack. When your heart beats too quickly, your heart ventricles can't fill with blood, and the heart pump less blood, which can make your blood pressure drop and cause heart failure. That would be all, and I'm passing the virtual floor to Mr. Val Shelton Mark.
Hey there, watchers. My name is chelton Marc, and today we're going to discuss about the hypotension, which is characterized by a blood pressure reading lower than 90 over 60 millimeters of mercury. Causes include dehydration, dietary deficiencies, pregnancy, certain medications, and underlying medical conditions like heart diseases. Symptoms of hypotension may range from dizziness and fainting to blurred vision, fatigue, trouble concentrating, and nausea. It's crucial to note that symptoms can vary among individuals. For treatment, addressing the underlying cause is key. Adjusting or stopping medications, increasing salt intake cautiously, staying hydrated, using compression stockings, and specific medications for orthostatic hypotension are some approaches. Balancing sodium intake is crucial to avoid complications, especially in older adults. Remember, individual responses to treatment may differ, emphasizing the need for personalized care. Now let's move to the intermittent claudication, a condition marked by muscle pain during physical activity, typically in the legs due to insufficient blood flow, often linked to peripheral artery disease. Causes include plaque buildup, narrowing arteries, exacerbated by factors like high cholesterol, smoking, hypertension, diabetes, kidney issues, cerebrovascular and heart diseases, and also age over 70. Symptoms vary from mild to severe, featuring leg pain, cramping, aching, burning, or weakness, along with skin discoloration and ulceration. Treatment encompasses lifestyle adjustments like a balanced diet and quitting smoking, medications such as antiplatelet agents, hemorrhagic agents, statins, and vasodilators, and surgical options like angioplasty, stenting, and revascularization. Now let's delve into the mitral valve prolapse or the MVP, a condition where the mitral valve doesn't close tightly, causing the valve flaps to bulge into the left atrium. Causes include mysomatous valve disease, genetic factors, and conditions like Marfan syndrome, Ehlers-Danlos syndrome, Epstein anomaly, muscular dystrophy, Graves' disease, and scoliosis. Symptoms of MVP can vary widely, with some experiencing no noticeable symptoms, while others may have heart murmurs, irregular heartbeat, dizziness, difficulty in breathing, fatigue, or chest pain unrelated to a heart attack. For treatment, individuals without symptoms may not require intervention. Severe cases might involve medications like beta blockers, anticoagulants, antiplatelet drugs, and analgesics. Surgery, including valve repair or replacement, may be necessary for those with severe mitral valve regurgitation. Now, let's discuss the occlusive vascular disease, or the peripheral arterial disease, a condition where arteries, often in the limbs, narrow due to arteriosclerosis, reducing blood flow. Causes primarily involve atherosclerosis with risk factors including smoking, diabetes, high blood pressure, abnormal cholesterol, high homocysteine levels, family history, obesity, inactivity, and aging. Symptoms of the PAD vary from asymptomatic cases to leg pain during activity, cramping, weakness, numbness, coldness, non-healing sores, skin changes, and weakened pulses. For treatment, lifestyle changes like quitting smoking and regular exercise are crucial. Medications include cholesterol drugs, blood pressure medications, antidiabetics and blood thinners. Surgical options encompass angioplasty and bypass surgery. Last in my presentation, we have the palpitations, characterized by sensations of abnormally rapid or irregular heartbeat. Causes range from stress, anxiety, and exercise to medical conditions like overactive thyroid or anemia. Symptoms include feelings of a racing or fluttering heart, sense in the chest, neck, or throat, Palpitations may be more concerning if there's existing heart disease, risk factors, or abnormal heart valve conditions. For treatment, addressing triggers is crucial. Lifestyle changes involve reducing caffeine, nicotine, alcohol, and stress, while medications may be prescribed for underlying heart conditions. Seeking professional guidance is essential to tailor the approach to individual cases. Remember, your health matters, and any concerns about all of these medical conditions should be discussed with a healthcare provider for proper evaluation and guidance. Stay healthy and thank you.
Good morning, sir. Good morning, everyone. I am Rochelle Lauigan. Pitting edema. Edema that retains the impression of a finger press to the skin. It occurs when fluid builds up in the body, causing swelling. When pressure is applied to the swollen area, a pit or indentation will remain. A pit or indentation means a hole or hollow. Although it can affect any part of the body, pitting edema usually occurs in legs, feet, and ankles. Next, polyarteritis nodosa. Potential fetal collagen causing inflammation of small visceral arteries. Symptoms depend on the organ affected. PAN or PAN, polyarteritis nodosa is a vasculitis condition affecting medium-sized vessels, causing systematic symptoms including constitutional, muscle, and neurological issues. Diagnosis requires specific criteria and treatment involves steroids and medications. Next is the Raynaud disease, a disorder characterized by abnormal constriction of peripheral vessels in the arms and legs on exposure to cold. Raynaud disease is a condition where smaller arteries narrow, causing vasospasm and limiting blood flow to affected areas. There are two main types, primary Raynaud's, which is mild and can go away on its own, and secondary Raynaud's, which develops due to another health condition and typically appears around age 40. Next is regurgitation, a backward flow such as the backflow of blood to a defective valve. It happens when a mixture of gastric juice and sometimes undigested food rises back up the esophagus and into the mouth. Last, stasis, stoppage of normal flow of blood or urine. Blood stasis may lead to dermatitis and ulcer formation. The state of equilibrium or inactivity caused by opposing equal force. Pathology is stagnation in the flow of any fluids of the body, as of the blood in an inflamed area or the intestinal contents proximal and obstruction.
Hello everyone, I am Norlene Lacerna. Subacute bacterial endocarditis or the SBE occurs when bacteria infect the inner lining of the heart chambers or heart valves, particularly in individuals with pre-existing damage, often caused by conditions like rheumatic fever. Rheumatic fever can lead to scarring and deformities in the heart valves, creating an environment conducive to bacterial growth. The bacteria gradually colonize the damaged areas, causing a more insidious and slow developing form of endocarditis. Compared to the acute version, SBE is a serious condition that may manifest with symptoms like fever, fatigue, and cardiac issues. The tetralogy of Fallot is a congenital heart condition characterized by spore-specific abnormalities. First one is the pulmonary artery stenosis, narrowing of the pulmonary artery, restricting blood flow to the lungs. Second one is the interventricular septal defect or the VSD, a hole in the septum between the heart's two lower chambers, allowing oxygen-rich and oxygen-poor blood to mix. Third one is the displacement of the aorta to the right. The aorta, the main artery carrying the blood from the heart to the body, is shifted to the right above the VSD. And the last one is the right ventricular hypertrophy. The right ventricle, responsible for pumping blood to the lungs, becomes enlarged due to the increased workload caused by the other defects. These combinations results in a complex interplay of abnormalities affecting the heart's structure and function, leading to a variety of symptoms and challenges for individuals with pathology of Fallot. Thromboangiitis obliterans, also known as Buerger's disease, involves inflammation and blood clot formation leading to the blockage of small blood vessels, particularly in the legs. This condition, which predominantly affects young men, is strongly associated with heavy smoking. The thrombotic occlusion of vessels in the legs can result in poor blood circulation and severe cases may lead to gangrene in the feet. Interestingly, patients with Buerger's disease often exhibit hypersensitivity to tobacco. Quitting smoking is a crucial aspect of managing the disease and preventing its progression. The term vegetation in the context of endocarditis refers to an irregular bacterial outgrowth on heart valves. In cases associated with rheumatic fever, this bacterial growth can cause damage to the valves, leading to the formation of vegetations. These vegetations consist of mixture of bacteria, fibrin, and immune cells, posing a risk for complications such as embolism and further valve damage. The last one is the Wolff-Parkinson-White syndrome, or the WPW. Is a cardiac arrhythmia characterized by tachycardia and premature ventricular beats. It arises due to an abnormal accessory electrical pathway in the heart, known as the bundle of Kent, which provides an alternative route for the electrical signals to travel between the atria and ventricles. This can lead to rapid heartbeats and irregular rhythms.
Good day everyone. I am Marielle Guinucud and I will going to discuss the diagnosis and treatment in cardiovascular system. So first we have ablation. Ablation is a removal or destruction. In cardiac ablation, a catheter is used to destroy a portion of the heart's conduction pathway to correct an arrhythmia. Cardiac ablation is a medical procedure that is performed to ascertain heart rhythm disorder, also known as arrhythmias. During a cardiac ablation procedure, a thin, flexible tube called a catheter is inserted into a blood vessel, usually in the groin or wrist, and threaded up to the heart. A catheter is used to destroy a portion of heart's conduction pathway to correct an arrhythmias. Second, we have angioplasty, a procedure that reopens a narrowed vessel and restores blood flow, commonly accomplished by surgically removing plaque, inflating a balloon within a vessel, or installing a device to keep the vessel open. So, cardiac angioplasty, also known as percutaneous coronary intervention, is a medical procedure used to treat coronary artery disease and improve blood flow to the heart muscle. Coronary artery disease occurs when the arteries that supply blood to the heart become narrowed or blocked by the buildup of fatty deposits called plaques. This can restrict blood flow to the heart, leading to chest pain or a heart attack. Just like in ablation, during a cardiac angioplasty, a thin, flexible tube called a catheter is inserted into a blood vessel, typically in the groin or wrist, and carefully guided to the site of the blockage in the coronary artery. The catheter is equipped with a special balloon at its tip, which is inflated once it reaches the narrowed or blocked artery. Third, we have artificial pacemaker, a battery-operated device that generates electrical impulses to regulate the heartbeat. It may be external or implanted, may be designed to respond to need, and have the capacity to prevent tachycardia. A cardiac artificial pacemaker, often referred to simply a pacemaker, is a medical device that is used to treat certain heart rhythm disorders or abnormalities. It is designed to regulate the heart's electrical activity and ensure that its beats is at normal rhythm. The pacemaker may be external or implanted. The implantation of a pacemaker is typically performed under a local anesthesia in a specialized medical facility. It is commonly used to treat conditions such as bradycardia or a heart block or maybe some other certain types of arrhythmias. Cardiopulmonary resuscitation or CPR. It is a restoration of cardiac output and pulmonary ventilation after cardiac arrest using artificial respiration and chest compression or cardiac massage. So CPR is an emergency procedure performed to revive a person who has experienced cardiac arrest or has stopped breathing. It is a critical intervention aimed at maintaining blood circulation and oxygenation to vital organs until advanced medical care can be provided. Lastly, we have cardioversion. It is a correction of an abnormal cardiac rhythm, may be accomplished pharmacologically with anti-arrhythmic drugs or by application of electric current. Cardioversion is a medical procedure used to restore a normal heart rhythm in individuals with a certain types of irregular heart rhythms known as arrhythmias. It involves the delivery of a controlled electric shock to the heart either externally or internally to synchronize the heart's electrical activity and promote regular rhythm.
Hi everyone, my name is Coleen Mangwag and I will discuss the continuation of diagnosis and treatment of cardiovascular system. So number 1 is the coronary angiography. The purpose of this procedure is to see if your coronary arteries are narrowed or blocked and to look for abnormalities of your heart muscle or heart valves. Coronary angiography is a procedure that uses a special dye contrast material and X-ray to see how blood flows through the arteries in your heart. Number 2, coronary artery bypass or CABG. Heart bypass surgery is a medical procedure to improve blood flow to the heart. It may be needed when the arteries are supplying blood to the heart, called coronary arteries, are narrowed or blocked. 3. Coronary calcium scan or heart scan. Special computerized tomography or CT scan of the heart. It looks for calcium deposits in the heart arteries. Coronary calcium scan results can help determine the risk of heart attacks or strokes. Number 4. Creatine kinase MB or CKMB, a form of enzyme found primarily in heart muscle cells. A creatine kinase test measures the amount of creatine kinase in your blood. Elevated CK levels may indicate skeletal muscle, or your damage, degeneration, either chronic, long-term, or acute, short-term. CT angiography. CT computed angiography or CTA uses an injection of contrast material into your blood vessel and CT scanning to help diagnose and evaluate blood vessels, disease, or related conditions such as aneurysm or blockage. Uses this a CT scanner to produce detailed image of your both blood vessels and tissues in various parts of the body. The last one is defibrillation, the administration of electric shocks to the heart in order to reset normal heart rhythm in persons who are experiencing cardiac arrest or where heart function is endangered. That's all, thank you. The next presenter is Marielle Magana.
So next naman is the echocardiography or what we call the cardiac ultrasound. So here, it is a non-invasive method that uses ultrasound to examine the internal cardiac structures. So dito sa echocardiography, they uses ultrasound to examine the heart and also the surroundings of the blood vessels, like how blood flows through them and also the pumping chambers of the heart. Next is lipoprotein or what we call the blood test. So here naman, it measures the level of lipoprotein of your blood. So like example, you have a high level of lipoprotein in your blood, so that means you are at risk of a heart disease. The next one is the percutaneous transluminal angioplasty or PTCA. Tinatawag din siyang balloon angioplasty. So ito yung procedure na ino-open yung coronary arteries natin na na-block due dun sa build-up of fatty deposits na tinatawag na plaque. So nire-restore nito yung blood flow ng heart muscles natin. And merong dalawang types ng PTCA. First is the balloon angioplasty. Here, nag-use sila ng thin tube na tinatawag na catheter. So, yung itong catheter na to, ini-insert siya dun sa large artery sa leg natin or sa forearm. So, once na na-insert siya, it is carefully guided to block yung portion ng artery natin. So, itong angioplasty, pinupush niya yung accumulated plaque against dun sa walls ng artery. So, nagre-restore siya ng normal blood flow sa heart muscles natin. And yung pangalawa naman is coronary artery stenting or what we call coronary stenting. So, here naman, nag-use sila ng small wire mesh to prevent yung blocked artery from renarrowing after angioplasty. So, why do you need PTCA? Itong angioplasty kasi, nire-reduce niya yung symptoms such as chest pain, shortness of breath, and enable you to resume normal activity. So, nire-recommend lang ng doktor itong PTCA if you were unable to improve your condition through medication or lifestyle changes, or you are experiencing worsening symptoms such as increased chest pain or shortness of breath. So, the next one naman is stent. So, ito ay isang tiny metal tube na kinikip yung artery mo. Ino-open yung artery mo to allow blood to go through better. So, nilalagay itong stent pagkatapos ng angioplasty mo para mas mag-flow yung blood mo ng mabuti. So, next naman is the stress test. Ito naman yung test kung paano nagwo-work yung heart mo during physical activity. Like yung cardiology mo, magpe-play siya ng electrodes or like yung sticky things sa legs mo, sa arms mo, or sa chest mo para ma-record yung electrical signals na nagre-create ng heart rhythms mo. Usually, itong stress test, ginagawa siya while yung patient is nagte-treadmill. Last but not the least is the troponin or what we call troponin test. So, ito naman, kagaya lang siya ng lipoprotein. Mini-measure lang din ito yung amount ng troponin sa blood mo. So, kapag mataas yung level ng troponin sa blood mo, you are at risk of a heart disease. So, pwede kang ma-stroke.